problematic computer use is a growing social issue which is being debated worldwide. Internet addiction disorder, IAD, ruins lives by causing neurological complications, psychological disturbances, and social problems. Surveys in the United States and Europe have indicated alarming prevalence rates between 1.5 and 8.2%. 1. There are several reviews addressing the definition, classification, assessment, epidemiology, and co-morbidity of IAD, 2 to 5, and some reviews, 6 to 8, addressing the treatment of IAD. The aim of this paper is to give a preferably brief overview of research on IAD and theoretical considerations from a practical perspective based on years of daily work with clients suffering from internet addiction. Furthermore, with this paper we intend to bring in practical experience in the debate about the eventual inclusion of IAD in the next version of the Diagnostic and Statistical Manual of Mental Disorders, DSM. The idea that problematic computer use meets criteria for an addiction and therefore should be included in the next iteration of the Diagnostic and Statistical Manual of Mental Disorders, DSM, 4th ed. Text Revision 9 was first proposed by Kimberly Young, Ph.D. in her seminal 1996 paper 10. Since that time IAD has been extensively studied and is indeed currently under consideration for inclusion in the DSM-11. Meanwhile, both China and South Korea have identified internet addiction as a significant public health threat, and both countries support education, research and treatment. 12. In the United States, despite a growing body of research and treatment for the disorder available in outpatient and inpatient settings, there has been no formal governmental response to the issue of internet addiction. While the debate goes on about whether or not the DSM-V should designate internet addiction a mental disorder 1214, people currently suffering from internet addiction are seeking treatment. Because of our experience, we support the development of uniform diagnostic criteria and the inclusion of IAD in the DSM-V11 in order to advance public education, diagnosis and treatment of this important disorder. There is ongoing debate about how best to classify the behavior, which is characterized by many hours spent in non-work technology-related computer, internet, video, game activities. 15. It is accompanied by changes in mood, preoccupation with the internet and digital media, the inability to control the amount of time spent interfacing with digital technology, the need for more time or a new game to achieve a desired mood, withdrawal symptoms when not engaged, and a continuation of the behavior despite family conflict, a diminishing social life and adverse work or academic consequences. 16-17. Some researchers and mental health practitioners see excessive internet use as a symptom of another disorder such as anxiety or depression rather than a separate entity. For example, 18. Internet addiction could be considered an impulse control disorder, not otherwise specified. Yet there is a growing consensus that this constellation of symptoms is an addiction. For example, 19. The American Society of Addiction Medicine, ASAM, recently released a new definition of addiction as a chronic brain disorder, officially proposing, for the first time, that addiction is not limited to substance use. 20. All addictions, whether chemical or behavioral, share certain characteristics including salience, compulsive use, loss of control, mood modification and the alleviation of distress, tolerance and withdrawal, and the continuation despite negative consequences. The first serious proposal for diagnostic criteria was advanced in 1996 by Dr. Young, modifying the DSM-4 criteria for pathological gambling. 10. Since then, variations in both name and criteria have been put forward to capture the problem, which is now most popularly known as internet addiction disorder. Problematic internet use, PIU, 21. Computer addiction, internet dependence. 22. Compulsive internet use, pathological internet use. 23. And many other labels can be found in the literature. Likewise, a variety of often overlapping criteria have been proposed and studied, some of which have been validated. However, empirical studies provide an inconsistent set of criteria to define internet addiction. 24. For an overview, see Bune et al. 25. Beard 2 recommends that the following 5 diagnostic criteria are required for a diagnosis of internet addiction. 1. Is preoccupied with the internet, thinks about previous online activity or anticipate next online session. 2. Needs to use the internet with increased amounts of time in order to achieve satisfaction. 3. Has made unsuccessful efforts to control, cut back or stop internet use. 4. Is restless, moody, depressed, or irritable when attempting to cut down or stop internet use. 5. Has stayed online longer than originally intended. Additionally, at least one of the following must be present. 6. Has jeopardized or risked the loss of a significant relationship, job, educational or career opportunity because of the internet. 7. Has lied to family members, therapist, or others to conceal the extent of involvement with the internet. 8. Uses the internet as a way of escaping from problems, or of relieving a dysphoric mood, for example, feelings of helplessness, guilt, anxiety, depression. 2. There has also been a variety of assessment tools used in evaluation. Young's Internet Addiction Test. 16. The Problematic Internet Use Questionnaire, PIUQ, developed by Dimitrovics, Sharidi, and Posa 26, and the Compulsive Internet Use Scale, CIUS, 27, are all examples of instruments to assess for this disorder. The considerable variance of the prevalence rates reported for IAD between 0.3% and 38%, 28, may be attributable to the fact that diagnostic criteria and assessment questionnaire used for diagnosis vary between countries and studies, often use highly selective samples of online surveys. 7. In their review, Weinstein and Leger, one report that surveys in the United States and Europe have indicated prevalence rates varying between 1.5% and 8.2%. Other reports place the rates between 6% and 18.5%, 29. Some obvious differences with respect to the methodologies, cultural factors, outcomes, and assessment tools forming the basis for these prevalence rates notwithstanding, the rates we encountered were generally high and sometimes alarming. 24. So training in emotional regulation can reduce the reliance on internet use as a coping mechanism. Given the social dimensions of internet addiction, involving family members or peer groups in treatment can improve outcomes. Social support fosters accountability and helps rebuild offline connections,